North Texas hospital tonight is accused of allowing a dangerous surgeon to operate on patients, causing paralysis, even death. The allegations are laid out in lawsuits against Baylor Plano Hospital by two patients who say the surgeon should never have been given credentials. And Channel 8's Brett Shipp has more tonight as News 8 investigates.
Dr. Christopher Duntsch had billed himself as one of the most accomplished spine surgeons in North Texas, such that in July of 2011, Baylor Plano agreed to pay him $50,000 a month plus expenses to work exclusively at their hospital. But according to a lawsuit filed by attorney Kay Van Way, Duntsch's previous employer had identified him as an egomaniac, mentally ill, an alcoholic, a drug addict, or a combination thereof. Baylor has yet to file a response and generally denies the allegation. Van Way says Baylor was warned, but hired Duntsch anyway.
But after that, there were multiple opportunities for them to stop him.
So he just went ahead and did it.
But Duntsch began his practice at Baylor. Kenneth Fennell of Oak Point says he was one of Duntsch's first victims.
I can't pick this leg up off the floor. I can't move it.
He underwent 2 surgeries. Van Way says both were unnecessary, the second of which left him permanently disabled. 1 month later, Duntsch performed back surgery at Baylor Plano on Lee Passmore. Passmore, who says he lives in constant pain with no hope for relief, is also suing Baylor.
I haven't been able to walk straight or run or anything since that surgery.
During surgery, an assisting surgeon noticed Duntsch allegedly botching Passmore's operation and had to physically intervene. Jim Gerards is Passmore's attorney.
Stop doing what you're doing because Duntsch was going to damage Lee's spinal cord if he continued, and Duntsch refused to stop.
Gerard says the altercation was witnessed by hospital staff but never reported, an allegation that Baylor denies. 1 month later, according to the suit, other surgeons described Duntsch as an impaired physician, a sociopath who must be stopped from practicing medicine. But no one stopped him from operating on his own roommate and best friend, Jerry Summers, who could walk the day before the operation at Baylor. The day after his surgery, he was a quadriplegic.
It's supposed to be a pretty common surgery, and I was supposed to walk in one day and walk out the next.
According to Fennell's suit, Summers admitted to nursing staff that he had witnessed Duntsch using drugs the night before his surgery. The lawsuit alleges an attorney representing Summers called Baylor Plano and reported the allegations concerning Dr. Duntsch's drug use. His privileges were suspended, but only for a few weeks. The suit alleges on his second day back at Baylor Plano, hospital officials allowed him to operate on Kelly Martin of Garland. Duntsch allegedly botched her surgery. She died from massive blood loss.
As soon as they found out that Duntsch was a liability, what should have happened?
They should have stripped him of his hospital privileges. They should have reported him to the Texas Medical Board. They should have reported him to the National Practitioner Data Bank.
Instead, Duntsch received temporary privileges to operate at another hospital, Dallas Medical Center. The suit alleges Baylor Plano sent a letter of recommendation for Duntsch to Dallas Medical Center, stating there were no adverse events or adverse issues associated with Duntsch. Duntsch confirmed that, telling News 8, "I had no negative reviews or disciplinary actions." He added, "They wrote me a letter saying that I was in good standing the whole time. There was never any discipline and I was never ever reviewed." A Baylor spokesperson told News 8 last year it did not file any complaints about Duntsch and, generally speaking, since we did not file any complaints against him, he would have been in good standing when he resigned. In a response filed in the Passmore suit, Baylor denies giving Duntsch a letter of recommendation and denies all of the key allegations being made in the lawsuit. The quality of patient care we provide is of paramount importance to us, Baylor says in a prepared statement. We take all patient care-related claims very seriously. According to the lawsuit, after Duntsch left Baylor in good standing, another of his patients, Llewellyn Brown, died of excessive blood loss following surgery. Another patient suing Duntsch, Jeff Glidewell, says the doctor left him partially paralyzed as well. Victim after victim, or their surviving families, all saying the same thing. Duntsch should have been stopped before he was allowed to operate on them.
At that point, they should have fired him, or they should have suspended his license until they figured out what was going on. But they didn't.
Now, the lawyers suing Baylor say their cases are made difficult by Texas law, which says they can't just prove that Baylor was negligent. Those lawyers have to prove malice, and that Baylor actually meant to harm patients when they allowed Duntsch to operate. Brett Shipp, Channel 8 News.